Hello everyone, welcome back to my channel. In this podcast, we are going to listen about Aesculus hippocastanum from Allen's keynotes. So let's get started. It's commonly called as horse chestnut, and it belongs to the family Sapiendaceae, which is very, I guess, very rare family. I've never heard until and unless I have been referring to this remedy very recently. So yeah, coming to the constitutions, it is much more suitable to the persons wherein there is hemorrhoidal tendency and who suffer with gastric, bilious, or catarrhal troubles. Let's go with the each and every term once again. So, what is constitution basically? I don't want to confuse everyone. Everyone has their own idea of constitution, and believe me, you are right in every way. To put it in simple words, some persons have wherein sulfur would be acting more. I'm giving just an example wherein sulfur would be acting more. You may have heard saying like he's much more seems to be like a sulfur patient, he seems to be like phosphorus patient, like that. So don't get confused. We are dealing with remedies, and how come normal makeup of a person can be compared with the disease picture. Remember the main idea of homeopathy: treat the patient, not the disease. So our drug pictures are a combination of the normal characteristics of the person as well as the diseased conditions, diseased symptoms rather than disease conditions, diseased symptoms. So there is an healthy aspect and there is a diseased aspect. So the healthy aspect is about the physical makeup of the individual and the mental characteristics that are found in the individual, and that too, it isn't any fixed idea. Like, it is only indicated in such persons when only constitution is there, only constitution is matched, not like that. It's like it gives much more dominance, much more weightage for that remedy to act in the given person, much more better, because it has been proven. Don't forget, every time you read your materia medica, remember those are the provings. They have been proved on persons. So there is always 99.1% chance. That's just to give, like, we are reading the remedies which have been proved many times, so that's why I'm giving like 95.5%. It has been proven in 95% on the given symptoms and characteristics only. The 5% there may be exceptions which we don't know. So the majority of the persons in which the given drug was, the specific drug was given, it has been proven and produces symptoms which are documented in front of you as materia medica. So have that in mind, because we often get confused while reading the materia medica actually what it is. We start with the remedy, and at the end of the remedy we don't know actually what we read, because we don't have that clear idea, clarity before we start to read the materia medica. So back to the drug. Constitutions for persons with hemorrhoidal tendencies. As you know, hemorrhoids, it's not just about piles, but it is mostly dealt with piles, because hemorrhoid is the swollen vein, especially in and around the anal region, due to the continued and excessive pressure caused in the long time, causes the vein to swell up and have that hemorrhoidal thing. So it can also be interpreted in for the varicose veins as such. So it's not just the piles, it also for the varicose veins. You can think of Aesculus, and who suffer with gastric, which is related to digestive problems, bilious, which is related to generally liver. In those days, liver troubles were very common and very rampant, related to the digestion. So that's why you find very often the term called bilious. So don't get confused. It's not really, it is definitely related to liver only, but you can interpret it, it is related to the gastric thing also, which actually covers everything. Or catarrhal troubles are excessive secretion of any excessive mucus secretion is called catarrhal. So any mucous membrane covering area, it has Aesculus as affinity to that. And the troubles generally tend to localize in these given areas too. What he was meaning to say is that the persons will have recurrent hemorrhoidal troubles and recurrent gastric troubles and recurrent troubles related to the liver, recurrent troubles related to the mucous membranes, like gastric has already covered that, also respiratory, etc. So coming to the mind, they are despondent, gloomy, very irritable, loses temper easily, and gains control slowly, miserably cross, Camomilla. So I don't get into this very deeply because it can be understood by the thing, it is just mind. So these are the mind symptoms which you can find in the persons where Aesculus acts well, but I have not come across so far like wherein for these symptoms Aesculus has been given practically, but it may have been proven in the proving days. So let's just decode the terms one by one. Despondent, these are all terms just to give weightage to the mood thing, affection thing, like that. So they're despondent, gloomy, they're very sad, and they're very irritable. They lose their temper easily. When you're sad or irritable, when you just get poked by anyone, you just lose your temper very easily and give a reaction very much easily. You just don't respond, you react. So and after you just lose out of your temper, it's very hard to get back to the normal thing. You will be in that vibration for some 1 or 2 hours. So that's the commonest picture, that's what he want to explain. And there is a term called miserably cross. Miserably cross may also be interpreted in such a way that in everyone's life there are some good things and there are bad things, right? There are not a whole thing of only good and there is not a whole thing of only bad. But the given scenario, what he's trying to explain is the person just tries to look only bad when there is also reason to celebrate about the good. I hope you understood. He just have overemphasis on the bad things and the negative things that are happening in the life. So that's what he's trying to explain. I've never come across such openly explaining patients. They had that privilege of exploring the patient to such an extent that they got such deeper pictures which patients will only reveal if you are very close to them. So that's the way of practice that used to be in the olden days. So yeah, next side heading is generalities. There is fullness in various parts as from an undue amount of blood, heart, lungs, stomach, brains, pelvis, skin. So as I already said, it can be interpreted in such a way. Hemorrhoidal, it is like stagnation of the blood, pooling up of the blood is like, there isn't any proper circulation. There is like slowness or sluggishness of the circulation, and that is found in the different organs. That is like heart, that is also in the lungs, it's in stomach, brains. He's given his brains, but it's brain, pelvis, and skin. So yeah, then comes, I mean, I'll just interpret shortly what he's trying to say. If excessive amount of blood is pooled up in heart, so you'll get something like palpitation or such. And in lungs, if it is like you'll be having SOB, so shortness of breath. If it is in stomach, I don't know excessively what fullness. Yeah, varices can be there, and there will be sluggishness of the, dilation will be there. There will be esophageal varices as such, but not exactly. But you can interpret in such a way. And there is in brain pooling up, then there can be an hemorrhagic thing, stroke sort of thing. Not exactly. See, these are only interpretations, not exactly. It will give an overall exact idea and understanding of the interpretation of Allen's keynotes. That's all. Pelvis, it's easily explainable. There will be which can also, there will be excessive uterine hemorrhage, or as such there will be also piles, as I've already said. And there will be in skin, you can say it as like varicosities, etc. And venous congestion, especially portal and hemorrhoidal, as I already said in the previous previous parts. There will be portal and hemorrhoidal congestion, so that's explainable. Mucous membranes of mouth, throat, rectum are swollen, burn, feel dry, and raw. So yeah, the mucous membranes, in the beginning also it was given there is catarrhal predisposition, wherein Aesculus will be acting very well. So there is burning also. They are swollen mucous membranes which are swollen. They are very dry and very much raw. So yeah, Then comes the throat. There is follicular pharyngitis, violent burning, raw sensation in throat, dryness and roughness of the throat. So now you can understand what he was meaning to say. In follicular pharyngitis also there is inflammation of the mucous membrane, and there is also added to that there will be follicles in the pharynx, sorry. And there is also violent burning, and there is very much raw sensation. They can't swallow. The presentation will be in such a way they can't swallow. When you examine, there is excessive congestion, and and they will say like it's some sticking sensation will be there, and they'll be like gulping down repeatedly, so that something stuck which they feel will go, but it won't go, but instead it will give them more and more pain. And the next point is what I'm dealing actually with: frequent inclination to swallow with burning, pricking, sticking and dry constricted fauces. On examination also, like if you examine the throat uvula, you will find the red congestion, rawness, and there will be excessive congestion, and the patient will be in very much discomfort. In such cases you can think of Aesculus. And the respiratory system, there is coryza, thin, watery, burning, rawness, and sensitive to inhaled cold air. So mucous membrane affinity is there. So there will be coryza, which is thin and watery, but there is burning and rawness. These are the two key points. There will be burning and rawness, wherein Aesculus can be thought of. And coming to stomach and abdomen, rectum, which is very important area of Aesculus action, there is dryness and heat of feels as if full of small sticks, knife like pains shoot up the rectum. These are the explanations I've literally heard in my practice. And the hemorrhoids are blind, painful, burning, purplish, but they bleed very rarely. That is very important. The congestion, it is not given as hemorrhagic tendency, it is given as hemorrhoidal, which is swelling up of the blood vessels exactly, but not bursting of like bleeding from the swollen blood vessels, which is entirely out of Aesculus approach. So in Aesculus there is pooling up of blood, but not coming up of the oozing of the blood as such. There is hemorrhoidal but not hemorrhagic tendency. So rectum is sore with fullness, burning and itching. That is common hemorrhoidal symptoms everyone will be complaining of. So there is constipation, which will be the contributing factor for the hemorrhoidal formation as such. There will be constipation, hard, dry stool, difficult to pass with dryness and heat of rectum, severe lumbosacral backache, which can be attributable to the excessive straining the person does when there is a passage of hard stool. That due to overcoming to that unfinished sensation, there will be always straining, and that will be the main cause in the production of lumbosacral backache. And stool followed by fullness of rectum and intense pain in anus for hours. They'll say like they can't even sit, and if they sit also they can feel their rectum due to the congestion. These are the symptoms exactly I have heard in my practice, and in such cases Aesculus works like miracle. Trust me, it's just miracle. Then comes female, prolapses uteri and acrid dark leucorrhea with lumbosacral backache and great fatigue from walking. Yeah, this lumbosacral backache is very much prominent symptom, and trust me, you can even give the remedy just basing on the lumbosacral backache, because I have seen a case wherein there was actually lumbar spondylosis, but the pain was lumbosacral pain, and the modalities are very similar to that of Aesculus, which I'll be dealing further. So yeah, lumbosacral pain is a very 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 prominent symptom of Aesculus. And the back, severe dull backache in lumbosacral articulation, more or less constant, affecting sacrum and hips. So it's like the whole belt area, like back and the thighs, and the hips, the side hips and back gives out during pregnancy, prolapses, leucorrhea when walking or stopping, must sit or lie down. Exactly, this was the modality wherein I seen Aesculus work like wonder. The patient was having lumbosacral backache with, it was actually a case of lumbar spondylosis. There wasn't any prolapse, any pregnancy or any leucorrhea, but the pain was lumbosacral pain, and the patient couldn't sit or stand or walk. Only she was able to do was lie down. Sorry, she was able to sit or lie down, but she couldn't even sit for long time. Lying down was the only thing which he was able to do. In such case, I've seen Aesculus just get down the pain within hours. Trust me, I've seen it work within hours, and that too in lower potencies actually. And yeah, and the sensation of heaviness and lameness in back. Yes, there is sensation of heaviness and lameness in back. Paralytic feeling in arms, legs, and spine. As the lower back is involved, the lumbosacrum involvement generally tends to produce the numbness and paralytic feeling. You don't feel any, you have any strength in the legs, and you just want, all you can do is lie down. That's all. So the aggravation is given in aggravation is by movement, backache and soreness by walking and stooping. Sorry, in the previous section also it was when walking or stooping, it wasn't stopping, it was a printing mistake which I have just read the same way. It's by walking and stooping the aggravation, inhaling cold air in the nasal complaints and the respiratory complaints, whereas in the rheumatic complaints, the walking or stooping is the very baddest thing they can do. So yeah, that brings me to the end of this remedy. In the next podcast, we'll be dealing with the relationships along with along with Aeschylus. So yeah, I've also in mid only actually I thought of dealing it with at the end, the case which I've seen where Aeschylus worked like just magic. I've dealt in between only. So yeah, that brings me to the exact end of the podcast. Hope you had some understanding of Aeschylus. Hope I was successful in what I was actually trying to explain. But this is a too good remedy to opt for in hemorrhoids when there is very minimal bleeding, and where there is excessive pain. Pain is very much out of proportion than the bleeding. So it's purely a venous congestion remedy which you can think of. It can be thought of in like, mostly I've seen and I've used it in mother tincture form, and also ointment when there is itching and everything. So yeah, so that brings us to the end of this podcast. Then hope you like this video. Give it a like, and if you have any queries related to the remedy, or if you want to have podcast regarding any other remedies from any other books, to comment in the comment section below. I'll try to help you by making a podcast on that. So thanks a lot for watching. Have a great day. Bye bye.